Leading and learning feedback. There are many types of feedback, including constructive and unconstructive feedback. Nurses use these skills to provide significant patient care. As a nursing professional, the skill of receiving and giving feedback is vital and necessary for professional development. Being able to effectively receive and give feedback would assist the nurse in improving their skills when undertaking tasks and for effective patient care. During the clinical placement, the nursing students are assessed in feedback, which is outlined in the third ANSAT domain, maintains the capability for practice. According to McCants and McCormack and the patient-centered care framework, feedback is associated with the prerequisite of being professionally competent. How nurses receive feedback is closely linked to the ACT tool, which stands for Accept and Listen to Feedback, Clarify, which means ask questions, seek advice and request tips for the future, and lastly, thank the person for giving you the feedback. Even if the feedback was negative and didn't help, it shows the professionalism of the person, and that links directly into the self-reflection that is performed by the nursing student. These skills are imperative for not only nurses to acquire, but also for any situation in your professional life, specifically when reflecting on tasks performed. There are key contributors to person-centered practice. Many of these are outlined in the patient-centered care framework. There are prerequisites that many believe nursing students and professionals should possess, which then develop into processes and consequently outcomes. Person-centered practice, as defined by McCormack and McCants, is an approach to practice established through the formation and fostering of healthful relationships between all care providers and others significant to them in their lives. This form of approach is key to every nurse, as it ultimately underpins the universal concept of patient care. It enables both the patient and their family and friends to confidently trust in the nurse or nurses at hand, building strong relationships and consequently better care. Person-centered care isn't broad. Conversely, it involves the patient individually, putting their wants and needs before their disabilities. McCormack and McCants' person-centered practice framework is a multi-layered structure involving multiple aspects of providing person-centered practice and care. One key aspect of this framework is the professionally competent prerequisite. This prerequisite outlines the importance of a nurse's skills, knowledge, and attitude regarding their overall professional competence. Within the framework, professional competence includes not only the assumed practical knowledge of the nurse, but also professional behavior and attitudes when providing holistic care, as well as the professional expansion of knowledge and experience of nurses throughout their entire career. A tool that is used to assist student nurses with their professional competency and development is the ANSAT tool. The Australian Nursing Standards Assessment Tool is an assessment tool used to monitor the performance and development of nursing students through observing their behaviours during clinical placements, with the assessment criteria being based on the Nursing and Midwifery Board of Australia standards. One of the key domains established in the ANSAT tool is the maintaining the capability for practice. This domain highlights the importance of self-recognition in regards to the individual student nurse's own practice, the health and well-being of patients, as well as the continuation of their own professional development throughout their placement and nursing careers. Aspects of this domain include demonstrating a commitment to learning throughout the course of one's career, using provided feedback and reflection on practice to continue professional development, displaying competency regarding patient education, identifies when own practice is compromised, and holds themselves responsible for professional actions and decisions. The prerequisite professional competence is defined by McCormack and McCants as obtaining the knowledge, skills, and attitudes to further negotiate care options for patients and effectively provide holistic care. In order to complete a task in a particular situation in a person-centered care manner, the nurse practitioner must take a holistic approach. A professionally competent nurse will have the ability to use the knowledge learned through education and experience gathered in a job or everyday life to deliver a good care experience. Professional competence also allows for a cultural awareness that culture shapes the delivery of care, thus promoting the existence of a healthful culture. Maintaining capability for practice derived from the ANSAT tool is directly connected to the delivery of person-centered care. The requirements in outlines include the importance of developing individual skills and attitudes with the incorporation of assumed knowledge. Reflecting on one's own practice and incorporating formal and informal feedback from peers to improve professional development helps to deliver person-centered care, as this will improve the care experience of the patient. Demonstrating skills to enable people to make decisions and take action about their healthcare increases the patient's involvement in care, thus person-centered care outcomes. Demonstrating accountability for decisions and actions by complying with the standards of practice and providing a rationale for the delivery of care in a safe and skillful manner will allow the patient to feel a sense of well-being. This increases person-centered outcomes while maintaining the capability for practice. Feedback aims to improve the practicing nurse's knowledge, skills, or behaviors and provides the learner with an opportunity to gain insight into their performance. A nurse's ability to receive and also give feedback is a crucial part of the learning process. Feedback is one of the strategies used by nurses to improve their professional competence. This strategy can be used to improve the practitioner's capacity to negotiate care options and effectively provide patient care. It is assumed that the type of feedback used will be affirming and positive in order to promote constructive feedback that will further improve the practitioner's development and furthermore competence. On the receiving end of feedback, acceptance, clarification, and thanking the individuals who are taking the time to help you are all important components. This allows for professional competence as it increases open-mindedness and improvement in the profession. Accepting feedback grants open dialogue through demonstrating an openness to new ideas and a willingness to listen. Clarification establishes exact examples of where this is need for improvement, and showing thankfulness to the person taking the time to help shows a positive attitude towards growth and improvement.